The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. This week's podcast is going to be a relatively short one, and we're going to pick up and discuss more about health plans' financial positions. The title of this podcast this week is, Will Health Plan Pain Continue? Last week, we discussed how every health plan is undergoing financial strain, but big healthcare, or the big national plans, were especially hurting. I weighed in on the current pain many large health plans feel and the fact that their vertical integration has not really saved some of them during the downturn. They also have become victim of overuse of prior authorization and risk adjustment in Medicare Advantage. Smaller and regional plans, on the other hand, tend to focus on member satisfaction, care coordination and management, and great brand. As such, they seem to be doing better in these tough financial times. This week, we'll go back to the overarching financial issues of the industry, and we're going to discuss insurers' financial states again and ask the question, will the current problems they are seeing, from utilization to rate reductions or low rate increases and a government crackdown on various practices, continue? So just as a refresher, compound annual growth rate EBITDA dropped by 1.2% from 2019 to 2024. So will all these struggles continue for the foreseeable future for health insurers, despite most big health insurers seemingly beginning to dig themselves out of their financial mess? My view, healthcare trends as well as government actions will most assuredly mean continuing bumpy times in all lines of business for health plans, big, medium, and small. With that, we will take our first break, and when we come back, we will discuss the various trends we can expect. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We did a brief intro on coming back to what will happen with insurers' financial positions in the future, and will the pain they are feeling today continue? So let's look at some of the trends I predict we will see across the health insurance industry in the next year to two. So we're going to start out talk globally and then go line of business. So first, overall globally, we can expect a return to pre-pandemic utilization demand continuing and cost growth of weight loss, specialty, and medical drugs. This will create major medical expense challenges for plans, and this will not go away in the near term. All lines of businesses likely will see fairly robust utilization and cost growth. We have seen annual spending growth trends of 6% to 9% in the past few years. For 2026 and some years beyond, annual trends likely hit at least the lower end of that range, with some lines of business, for example, employer coverage, seeing cost trends at the high end of the range. Plans' efforts to reduce the trends are more limited given restrictions on prior authorization and traditional utilization management that have popped up in regulations and laws at both the state and the federal levels. Let's talk now about some specific commercial or employer trends. Well, on the employer front, businesses will continue to demand greater accountability from their healthcare entities. More will seek to carve up how care is delivered. Employers, too, will scrutinize health plan and pharmacy benefits manager agreements with employers and with other entities to ensure maximal efficiency and value. This will mean increasing pressure on health plan returns from the commercial and the employer-covered sector. Benefit offerings will likely erode as well, with consumers continuing to pick up a greater share of costs. Let's now look at the exchange line of business. As enrollment rose in the exchanges, finances in this line of business stabilized. Premiums dropped or grew at relatively low levels. Insurers saw risk reduced. Plans returned, expanded, and grew in the market. All this could change given regulatory measures of the Trump administration, the budget reconciliation bill reductions, and the expiration of enhanced premium subsidies. Millions, over 8 million, could leave the exchanges, which brings back the prospect of fewer plans, skyrocketing premiums, and higher risk. Preliminary data from state insurance regulators point to major double-digit premium hikes in many states. With that, we will take our second break, and when we come back, we will discuss expected Medicaid and Medicare Advantage trends. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about what can health plans expect in the future. Frankly, I think the pain will continue. So we left off after the exchanges before the break, and now we're going to talk about trends in Medicaid and Medicare Advantage. So in Medicaid, the Trump administration regulatory changes and the budget reconciliation bill could mean almost 8 million lose Medicaid coverage. Medicaid managed care has already been financially challenged due to lower enrollment and rising risk with the return of Medicaid redeterminations. Plans have complained that rate hikes are not keeping up with the costs from rising risk of those who have remained in Medicaid. We could see the same phenomenon happen as more leave the Medicaid rolls if the budget reconciliation bill is passed. Let's hit the Medicare Advantage expected trends now. A combination of lower STAR scores and revenue, low rate hikes, risk adjustment model changes, and strict limits on prior authorization turn normally reliable margins in the industry on their head. This led to massive retrenchment in MA in the market in 2024 and to a greater degree in 2025. Plans scaled back where they offered plans, shuttered certain products, and scaled back generally. Benefit designs became leaner, thereby increasing consumer costs and premiums. While the Centers for Medicare and Medicaid Services has a slated 5% plus rate hike for 2026, plans likely would have had to continue to pull back a bit anyway. but utilization trends and the threat of major risk adjustment revenue recoupment could lead to greater retrenchment than expected. As I noted, big MA plans were making progress getting back to investor-demanded margin levels, but the road to such profitability in MA could be longer now. With all of the trends discussed about the expected pain into the future, we'll take our last break and come back with the conclusion. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this short episode of the Healthcare Labyrinth podcast. We're now at our conclusion. And so what will plans need to do given all of these major trends toward additional costs, lower rates, for example, lower enrollment, and regulatory scrutiny from state and federal lawmakers and agencies? So, thus, across the board, plans will need to further adjust their recovery assumptions as they seek to turn around margins. They need to revisit revenue, cost, and margin assumptions. This inevitably will lead to continuing flux at health plans and for the general public consumers as a whole. Plans will likely need to further downsize operations and staff to reduce administrative costs and rein in benefit offerings in where they offer health care. Consumers will see more of fewer benefits and choice as well as increased costs. With that, we will conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.